Good morning, everybody. Thank you so much. Today I'm going to speak about the investigational drug delivery technologies in glaucoma. So drug delivery to the anterior segment of the eye has always been a challenging issue. Topical eye drops, the most common route of administration for treatment for ocular anterior segment disease, has a low level of bioavailability of 1% to 10%. Hence, the therapeutic concentrations may not be reached. In addition, the topical eye drops often have a short duration of action, so that frequent application of drops is required. This may result in patients' discomfort due to ocular surface toxicity, and the correct dosing regime is highly dependent on the patient's compliance. Now, in this flow chart, we can see the various investigation drug delivery technologies that are available to us. Mentioning the few: the sustained released bimatter loaded biodegradable implant, the subconjunctival route, example the timolol Vision's Helios slow release insert, the punctal plug delivery system, for example, Evolute minimally invasive sustained delivery platform, the anterior segment sustained release therapies, example, ocular therapeutics, and lastly, the intracameral polymer injections, which provide up to 6 months of active drug release. So what are the strategies employed to increase the ocular bioavailability? These include the design of the drug delivery devices to release the drug at controlled rates, the use of vehicles to retard the precorneal drug loss, and the synthesis of the prodrugs with increased corneal penetration properties. We have to understand what a biodegradable implant is. A biodegradable implant is a matrix containing a biodegradable polymer. What are the advantages? The advantages include the fabricated to modulate the amount and duration of drug release, tailoring to different ocular surfaces and severities, provide a stable drug concentration over weeks to months, and this eliminates dependency of patient's compliance. There is no need to remove the implant from the depletion of the drug because the implant undergoes hydrolysis. Hence, in order to reduce the intraocular pressure, the anti-glaucoma drugs must penetrate into the inner eye. The ocular bioavailability is determined by the capability of the drug to penetrate and eliminate too. Now, the few of the coming to the examples: the sustained release bimatter loaded biodegradable implant, which is the bimatter which is released intracamerally. Then we have the anterior segment sustained release therapy, that is ocular therapeutics, bioresorbable intracameral implant, for example, the travoprost, the polymeric films, which is the timolol loaded PLGA films. Coming to the punctal plugs, these are small size biodegradability, non-toxicity, non-invasive and controlled drug delivery drugs. And lastly, the Foresight Vision 5 Helios, which acts on the surface of the eye under the eyelids, for example, the bimatter prost. Now, what are the constraints for ocular drug delivery application? The constraints include the lower ocular bioavailability, the precorneal drug loss, the rapid tearing, the non-productive absorption, the transient residence time, the impermeability of the drugs to corneal epithelium, the nasolacrimal drainage, and systemic toxicity of the drug. Hence, to conclude, the development of the suitable drug delivery system has been widely explored through the years and in the last decade, and several novel drug carrier systems have also been studied. Further studies are needed for meeting the potential challenges in the area of the ophthalmic therapeutics to overcome the limitations and conventional formulations like low bioavailability, the frequent dosing intervals, systemic toxicity, and the patient compliance. Thank you so much for your patient hearing.